We've talked a little bit about advancements in treatment. Where are we research-wise? A lot is going on too with cancer research, correct?
It is. So research is ongoing. The research now, I think, is going to take a big turn, and it's really going to develop into something a bit different. In the past, research has typically been done looking at, again, all lung cancers. But now the research, I think, is about ready to make a change in that we're going to go after certain targets. So there may be a target that is the same in a lung cancer versus a breast cancer versus a colon cancer. And the drugs now may look at how does that drug affect that target, whether it's on different cancers or not. In the past, we've looked at how does this drug work on colon cancer, for instance. So I think that's potentially very exciting in the research realm, that we're making that shift towards more of a targeted approach.
And I know our viewers and everybody's becoming very savvy, and we appreciate that too, as far as reading and making sure that they are an informed healthcare consumer. We hear a term called clinical trials. That is something that is out there. Can you explain a little bit about what a clinical trial is?
So a clinical trial is when a patient agrees to undergo a potentially new type of treatment. A lot of times it will be what we know is the best, plus maybe one additional drug that we think has a lot of potential. And those patients will then get enrolled on the trial. A lot of times it's randomized, and I don't know what patient's getting what drug, and neither does the patient. And we compare the new treatment against the historical treatment to see how they do. And this is how we make advancements in science and in oncology care, is trying to figure out if these new agents are beneficial.
Good point, because we wouldn't be where we are today if we didn't have those clinical trials from the past, correct?
That's
so
right.
We have to keep doing that and seeing what is best.
Right, and when I see patients in my clinic, I tell them I use that history, I use that data. Everything that I do is based on fact and evidence, and I use those tens of thousands or hundreds of thousands of people that have agreed to go on clinical trials to give us this incredibly invaluable information to know how to treat these types of cancer.
Let's go back to the patient a little bit. We've been talking a lot about treatment, obviously, and the patient has a lot that they are taking on when they hear the word cancer. And I know with the Cancer Care Center, there's that team approach, so we're very concerned about that individual, the patient, and making sure that the family is involved in making the right choice for them, correct?
Correct.
So everybody is there guiding them, in a sense, through making some of those choices that are best for them too. Yes?
That's right.
And I think they need to know that choice ultimately is theirs, but they're partnering, of course, with the physician and the team to get the best care that they can.
That's right. I tell patients all the time that they're the boss, not me. I lay out their options and I let them make a choice. Usually I'll have a recommendation. Sometimes I'll have more than one recommendation, but I think you're absolutely right that patients deserve to make their choice, and what might be right for me may not be right for someone else in their family, and I respect that.
I think the great advancement, I guess, that I can think of, in the time period that I've been in healthcare, is that we have people actually in remission or have been treated years out. I mean, look at that. You have people that have been diagnosed, treated, and then are either in remission and or completely taken care of. So that didn't happen many years ago. So medicine is remarkable in the advancements that it has made in the care for the patient and the quality of life too, because people now can work and, as you were saying, maybe take the chemotherapy orally and different things too. So very important information that we're sharing today.
Yes.
Dr. Lai, we've been talking about the advancements that we've made in cancer, but we also know it's very serious because it still is the number one cause of death, correct? Tell us a little bit more about those statistics.
Yeah, so unfortunately for most adults age 30 to 80, cancer is still the #1 cause of death. It's above heart disease. Once we reach the age of 80, heart disease becomes #1, and then cancer is #2. So for most all adults, it's either the #1 or the #2 cause of death. And even though we've made good strides and people are living longer with cancer, it's still an extremely important topic and an extremely important thing to discuss.
What types of cancer are we seeing?
So for women, the most common type of cancer diagnosed is breast cancer. However, the most lethal or the most deadly cancer is lung cancer for women. And for males, the most common is prostate, but again, the most lethal is lung cancer. So we live in a state that has a really high incidence of lung cancer, and that's one of the reasons we're above the national average, and probably the reason why we're #1 overall.
So obviously, if we go back to lifestyle risk factor, one of the things we could do to prevent with lung cancer would be smoking.
Yes,
correct?
That's right.
And then we look at some of the other health risk factors with some of the other cancers that you had mentioned as far as prostate and breast too, correct?
Correct, yeah.
What about colon cancer? That ranks up there in the top 5 too, correct?
Colon cancer's usually in the top 5. It changes every time these new numbers come out, but colon cancer, now we recommend colonoscopy starting at the age 50, or maybe even sooner if you have risk factors as far as family history goes.
Both male and female.
Both male and female, that's
so
right.
Colonoscopy, a lot of advancements that have taken place as far as the prep for that. So you can take the prep, and usually the rest of the day you're good to go. It depends on the age factor, of course,
Sure.
too,
Yeah.
which prep you are able to take, but a lot of advancements and very minimal compared, finding out your risk factors
Sure.
there too.
Yep, and I tell people the nice thing about a colonoscopy is if you have a normal colonoscopy, which is what everyone hopes
Right.
for, you only have to do it every 10 years.
Exactly.
So that's great.
That's that minimal part we're talking
That's right,
about,
yeah.
exactly. Now mammograms are a little bit different. We should get those starting what age?
Very controversial.
Exactly.
Some people recommend age 40, some age 50. So
Talk to their physician.
Yeah, talk to your physician about it. I see both, and I think both are very reasonable approaches.
Right. It's based upon risk factors and different things too, but
Correct.
Basically, again, that is a minimal low dose. They can have their mammogram and very quickly and
Right.
back to their
Yeah,
rest of their daily routine.
And some women even earlier than age 40, again,
Right.
based on risk factors. It really is a tailored approach nowadays for cancer care, even with screening.
Now we talked about colonoscopies and also mammograms. What about prostate? We had mentioned prostate being, a
Yeah.
very common cancer. What can we do as far as risk factors there? And
Pro-
actually screening, excuse me.
Prostate cancer is even more controversial than breast cancer for screening. Only about 1 in 4 men that have an elevated PSA will end up having prostate cancer on biopsy. So there are a lot of what we call false positives, meaning that we think they might have prostate cancer and then they don't end up having it. So for that reason, most people recommend against routine screening for everyone. However, again, there are certain people, especially if you have a family history, that you need to talk to your doctor about regular and routine screening for prostate cancer.
And usually that's, in a sense, 2-part, right? The PSA lab work and then a digital rectal exam.
Correct, yeah.
To check, right?
That's right.
So kind of don't want to do one without the other to make sure that everything, again, as you said, the false positives and different things
Correct,
too.
that's
So
right.
really important, as we have been talking about, to really talk to your healthcare professional about your personal risk factors and when you need to be screened for the different types of cancers that we were just addressing right now. Now we've been talking about the importance of, as far as the leading cause of death, with cancer ranking right up there until we reach that certain age for heart disease to kind of come over. And this is so important as, we're talking about advancements and prevention and awareness. Here we are in Hardin County and we're making huge strides here as far as our treatment care that we have here at Hardin Memorial Health. Tell us a little bit about what's going on.
So part of my mission or my dream, I guess, is I want to have a standalone cancer center for not just Hardin County, but the surrounding counties. A center where it's only cancer patients and the cancer patients can see their physician, their oncologist, but also get their care all in one building. And this is something that the hospital is also supporting me with everything that they have as far as making this happen. So as early as spring 2014, we will have a temporary standalone cancer center. And our bigger plan, which has also been approved, is a much bigger cancer center, standalone cancer center, which is going to be a completely new building that's going to be added to Hardin County and the HMH system. So I'm very excited about that. I think that our region, really, not just our county, needs this. And you know, we see, as we've talked about today, how prevalent cancer is, not just in the country, but especially in our state and in our area. And you know, it's not just Hardin County. I think I counted 4 or 5 of the surrounding counties are also above the national average. So we have a lot of cancer in this area, unfortunately, and I think we owe it to our patients, our neighbors, our family, that we have a nice comprehensive cancer center, and that's what I'm wanting to build.
And I think that's super important because we are a regional healthcare center, and being able to have that accessibility, that quality of care is what Hardin Memorial Health is all about. So we appreciate your time today with us and sharing this important news. And if you have any other information that you'd like to find, we ask you to visit our website at www.hmh.net. Thank you for joining us today, and we hope you tune in next month for another important edition of Health in the Heartland.